pregnancy or like an aggravating factor. And this is looking at not only just in pregnancy, but within 1 year of pregnancy and delivery. So Tennessee is actually one of the top 5 worst states when it comes to that. Just some kind of facts to think about. They did some studies over 2017 to 2020. And so what came out of that in 2020, discrimination contributed to 1 in 3, which is about 33% of pregnancy-related deaths. And within discrimination, of course, there are things associated with it like biases and mistreatment from healthcare workers, from physicians, and that type of thing. For non-Hispanic Black women, were 2.5 times more likely to die compared to Caucasian women when it came to pregnancy and pregnancy outcomes within 1 year. Most of those, approximately 89% of those pregnancy-related deaths were deemed preventable, with 24% having a really good chance of being prevented. And so of those, when we kind of look at the things that contribute to these adverse outcomes, we're looking at things like mental health disorders, substance abuse disorders. The 3 leading causes and kind of categories for disorders and diseases that we see affecting specifically Black women and Hispanic women negatively during pregnancy and after pregnancy, top being cardiovascular and coronary heart disease. So specifically, most importantly, things like hypertension, whether that's pre-existing hypertension or hypertension once you were in the pregnancy, and or hypertension that persists after pregnancy. Another was hemorrhage or bleeding associated with pregnancy, oftentimes in that postpartum period after delivery, whether that delivery was a vaginal delivery versus a C-section. Infection was also grouped in with that, and then of course mental health. Newer studies are now also including deaths and outcomes related to COVID-19 also. We just don't have as much information on that because we're still kind of at the forefront of that. And so really, Tennessee as a state, hospitals, healthcare workers have been charged with doing something about this and figuring out exactly why this is happening and why it exists. And that's one of my passions. And so, of course, we'll be open to questions later on. But again, one of the biggest things is patients being able to advocate for themselves, and moms being able to advocate for themselves and for their babies. But then also eliminating those issues of mistreatment, eliminating, like the video touched on, not trusting what a patient is saying. And so I think advocacy for yourself, advocacy for your daughter who is pregnant, advocacy for a friend that you know who is pregnant. I think the biggest thing is if you think something is wrong, if you feel like something is wrong, say something and ask until you find somebody that takes those things seriously.
Okay, let's go on. Applause.
So you will be getting your cards ready. I know that there's some questions that you would want to ask this smart person. Now, we're going to go over here to have someone talk about oral health and her work in industry.
Hello, everybody again. My name is Dr. Patman. I currently work at Dental Partners East Ridge, over off Ringgold Road, and I don't have too much to say, but I do want to emphasize the effect of oral health as it relates to the whole body systemically. I think it's really important for people to consider that when you're talking about your dental care, it's not just about the mouth. Your mouth is the vessel to the whole system. And so oftentimes we neglect the fact that gum disease can be related to heart disease, stroke, diabetes, pregnancy complications, Alzheimer's, and also some cancers. About 90% of systemic disease can be caught in the mouth first, so it's really important to get your regular dental checkups and screenings every 6 months. Even if you feel like it's some toothache that comes and goes. I get that a lot in a lot of patients I see. That doesn't take away from the source of the issue if we don't, at least check it out and see what's really causing that. And it could be something bigger. It couldn't, it might not be, but it's most important to know what to be aware. So as it relates to women's health, though, I think I see the biggest concern with young women in pregnancy in the way that oftentimes I hear that their teeth go bad during or after their pregnancy, and that's due to the vast changes that they see in their hormones, acidic levels in their salivary content, and also their habits. You might not have the best oral hygiene, or your diet might change in total when you're pregnant, and so a lot of times you might experience premature delivery, low birth weight for the baby, preeclampsia, gingival tissue ulcerations, pregnancy granuloma, and pregnancy tumors can all be, causes of poor oral hygiene or complications of dental health during your pregnancy. And those are things that a lot of people are not aware of, especially young women during their pregnancy. As for oral health information, that's my main, that's all I have.
We'll have questions for you. We will have questions.
Plenty of questions, I can take questions, but that is the biggest flag I wave as far as oral health when it comes to systemic health in women.
Thank you. I know everybody's gonna have some questions. Supposed to move that along.
You want to just leave it right there? Okay. Next, we're going to have Miss Star. Well, she just wants me to call her Star because I was reading her bio. One thing I didn't say about her is that she is a very creative founder of and CEO of Amazing Teens, which is a community engaged program that brings resources together to support high school students. Been in this work for over 20 years. She is my kin because I also am a licensed social worker, mastered, and you're in public health too? And work at the hospital. She's worked in end-of-life care, which I have too, so we're kind of like joined at the hips. So now we're going to have you to talk about this whole equity issue as it relates to health and people.
I'm gonna stand because I can't see the people over there and I don't want to hide. But good evening, everyone, and happy Thursday. Yeah. So my name is Star, and I currently serve as the hospital's patient liaison, communications manager. I teach physicians how to communicate with people. Star, why do you do that? Great question. I'm glad you asked. I say that because a lot of patients, a lot of people don't understand how healthcare moves now. We understood before that healthcare was driven by what the providers thought was important for the patient and the family. Well, newsflash, breaking news, that's not how it goes anymore. Healthcare is driven by patients. Every time a patient leaves the hospital, there's a survey that leads with them or quickly follows them to ask them basically, how did they do with you? How did they do with your care? Sadly enough, most patients or their families, they're not really sure what the guidelines, what the laws are, what the operation responsibilities are for healthcare providers. And so they go to where? Yeah, you guessed it, Google. And they have decided that Google is their healthcare decision maker, and they have decided that that's where they're going to get their information. And they'll bring all of that information to you as the provider and tell you what it is you should be doing. So when we think about that, we want to think about the big picture. And with my job, my responsibility rests between medical and risk management. And what that means is that I keep the hospital from being sued. And so when I look at health disparities and diversity, equity, and inclusion, and please say this word with me, justice.
Justice.
Because without any justice, which requires action of us, the rest of it is useless. So when I think about diversity, equity, and inclusion, and justice, without that, hospitals are charged, or the United States in general is charged $46 $460 billion per year to address all the issues that come with health disparities and inequities in healthcare. We're looking at population health, and that's focusing on certain groups of people. We've also heard and read before how certain groups of people, even like with what Dr. Patton was saying, with dental care, certain people just don't have teeth, right? There's a reason for that. So tonight, I'm just encouraging you to open up, ask questions, and explore some of these empty holes that some of the government is not really allowing us to take a peek at. Because tonight, you've got questions and we've got answers.
Okay. Let's give these three powerhouses a round of applause. Now, let me just check about the logistics of how we're set up here. We have a Roman mic on this side. Do we have one on this side too? You're the Roman mic. And what we're going to do is we're going to give you an opportunity to participate. Don't you hate going to talks and you don't get ever asked your questions? You can't say anything. Well, tonight is your opportunity to ask your questions. We've talked about advocacy. We've talked about mistreatment. We've talked about access. We've talked about issues dealing with mental health and all the different things that's going on in healthcare. We've even talked about justice. Let's say it again, justice. Okay, we want justice because we want to be informed. So tonight, this topic, knowledge is power. The more we know, we got a medical professional, we have a dental professional, and we have a person that advocates for not only the patients, but also for the hospital. So we're prepared now to receive your questions and see how these professionals, we call them the subject matter experts. We have subject matter experts here. So let's see, any questions that anybody has written on their cards? If you don't want to stand up and speak out your question, we got one back there. And if you have it written on your card, you can hold it up and wave it. Karen, if you can watch this side over on this side, and we can get these questions asked by our roaming. Get on that side. Yeah.
Okay. Question number one. How do you get the ER to give you accurate information from your test?
Okay. Do we have someone who'd like to answer that question? Our risk management person here.
So the emergency department, once the tests have been completed and the results are in, it is required that the physician actually delivers that information to you. Your nurse may or may not be coming in and out of that room, but even if so, that nurse is not allowed to actually provide that information to you. Some results take a little longer than other results to come in, and then it requires, like if radiology, the physician in that radiology department is required to look at that information, deliver that information back to the ED physician, and then that physician is going to deliver that message to you. So whatever that specialty is, that is the physician that is required to read it, translate, deliver it to that next level that is right up under the next level of care for you.
And I might add that your medical record is just that, your medical record. Follow up.
If the ball is dropped, who do you hold accountable?
If the ball is dropped, who do you hold accountable? Doc? You want to finish up your we'll let her finish up this and then we'll get it.
If the ball is dropped, and if you are we talking about, what type of setting are we talking about?
Talking about the ER?
Was it the ED?
It was the ED. Mm-hmm.
Like results from an MRI or
And you didn't get the
blood
results.
test or whatever, and it comes back and there's something indicated, but
So
you're
there
never
is
told that.
Okay, so there is always somebody in charge of the person that is in charge. And in a hospital setting, you always have a person like me who is responsible for understanding from our patients and their families what their care has been like. So you can always ask for the patient representative, you can ask for the patient liaison, you can ask for the patient administrator, and then I personally actually retrieve your information. I personally go in your chart, I dig through, I find the information, I find the gaps, I find the holes, and we are required by law to respond to you within a certain amount of time. Sometimes that response is only, it can be 7 days. If I can resolve it in 7 days, then that's great. But I am required to let you know if it can't be 7 days resolved, then I have to at least let you know by letter, hey, I'm still working on your stuff. We've got until this day, which is gonna be 30 days. Joint commission, everybody know what joint commission is? Joint commission is the governing entity for hospital care. And so they're gonna come to me whenever they get ready. And they're gonna ask me, starting to see all of your concerns and all of your complaints that came into your hospital. And I'm gonna have your question about that MRI and how upset you were about that and what we did to remedy that. So I probably shouldn't be telling y'all this, and if y'all said I did, I'm gonna say y'all are telling them. So probably what I'm gonna do, I'm gonna offer you an adjustment on your bill. Because I don't want you to be, I want you to make sure your husband keeps coming. I wanna make sure that you bring your kids. I see, if I make you mad, I don't see it as just you. I see it as your whole village. So I'm gonna make sure that I try and keep you happy. And if we can't communicate well, and I don't mean you get what you want, I mean you walk away with an understanding.
Okay. Now I have a question. I'm going to ask some here so we can make sure we get all these subject matter experts. Now, Dr. Adams, you mentioned that there were some leading disorders that people don't necessarily, as it relates to pregnancy. You talked about mental health. You talked about the issues about bleeding, and then you talked about cardiovascular kinds of concerns and hypertension. Could you elaborate a little bit on that, in particular when a person is pregnant and having some challenges, or they're having a good day, how these particular things impact that person?
So these are things that if you have pre-existing conditions, then of course those things are brought up at the time of like your first visit. What we see most often is these issues become a bigger issue midway through the pregnancy or after the pregnancy has ended. So a patient who's never had high blood pressure is pregnant, has issues with high blood pressure, has preeclampsia, which is a fancy way of saying really, really bad blood pressure in pregnancy, so bad that it starts to affect your kidneys, your liver, and that type of thing. And so the issue becomes that we see adverse outcomes after that pregnancy is concluded. So either a patient who should be put on medication after pregnancy is over that is not put on medication, or a patient after pregnancy sees their OB doctor at that 6-week postpartum visit, but then doesn't have the things set in place to connect with a primary care physician to continue managing those disorders and making sure that they're better. From a mental health standpoint, there is a screening that's recommended by ACOG, which is the overall governing body for obstetrics and gynecology. And that screening, it's a depression screening, so screening for postpartum blues, postpartum depression, has routinely been given to patients at the end of pregnancy. The new recommendations are to do it at the onset of pregnancy, in the middle of pregnancy, and then again at the end to make sure that we're not missing anything. We've really focused on postpartum depression, but we need to be screening patients during pregnancy because if they are either at risk for depression or develop depression in pregnancy, it's not enough to just address that at the end. And then that goes, hemorrhage and infection are a little more related to at the time of delivery. But again, what oftentimes can happen is there's a delay in recognizing that there is a problem, that there is excessive blood loss, that we need to do more, provide more medication to prevent excessive blood loss.
Okay, well, we're going to put a pin on the question. And I know that's on somebody's card about why is there such a high percentage of African Americans and women of color having bad outcomes in regards to the life of a child. So put a pin on that, we'll come back. Now we got a question back here.
The next question, this question is also related to pregnancy. Who advocates for those who are pregnant but have mental illness?
I think you addressed that a little bit, but you want to just maybe a second or two, just touch on that?
So that, of course, patients advocating for themselves, family members, I think it's important to bring trusted family members into those discussions and into the office.
Trusted.
There are more programs that oftentimes aren't disclosed to patients. I think sometimes it's an issue of physicians or offices not knowing what those programs are, but there are programs out there to provide that support, to provide that advocacy. One comes to mind, Nurse Family Partnership. It's a program here in Chattanooga where a newly pregnant mom is paired with a nurse, and she can go to appointments with them and can remind them to ask certain things and can advocate for the patient if the patient allows. I have patients who their nurse that they're partnered with has signed a release so she can relay information to me, and that's how I have found out different things about my patients that they don't maybe feel comfortable at the time saying in the room. And then I connect with their nurse that they're partnered with, and they say, hey, this is actually what's going on and what they're dealing with. And so I think a lot of it comes to a lack of knowing what resources are there for advocating for those specific things.
Well, I want you to know that one of the things that I've been advocating with across the country is that we have social workers and case managers in physicians' offices. I know they said that's very costly, but ever since I graduated in and been out there working in the field, I have been advocating for a social work clinician to be in the primary care physician's office because they can't doctor because they're trying to handle all these things. And the social worker and our case manager is the person that has a lot of the information and a lot of resources. And I'm going to go over here to Dr. Patton. You mentioned that 90% of gum diseases has a adverse impact on the women. Could you elaborate on that just a little bit in regards to that? And why is there anything hereditary that's going on with people of color regarding their teeth and their gums that causes these many, many problems?
I wouldn't say that it was necessarily hereditary, but I think there definitely is a disparity in Black access, Black families, Black people, as far as their access to health and their awareness of treating all sorts of diseases and infections. And the biggest thing I think is the access to regular treatment and having checkups to see those things. There are certainly, hereditary sort of diseases, but when it comes to gum disease, a lot of other systemic issues are manifested in the gums, and so that's what it is. It's different types of nodules or papules or granulomas can be seen in the mouth and noticed, and if there's any sort of other systemic symptom like maybe acid reflux or irritable bowels or something like that, it can be related, and maybe you can even catch metastasis of different cancers in the mouth as well. So, yeah, not necessarily just hereditary, but
What about nutrition? Does nutrition have any impact on the teeth?
absolutely. Depends on what type of vitamin, your vitamin intake and things like that. But as it relates to oral health and diet, it's the sugars and the carbs and the sodas and the carbohydrates that cause
The
cavities.
Sprites,
Yes.
the Cokes.
Yeah, the dark drinks that are
drinks.
Carbonated, those are the ones that make the most impact, the ones that hold the sugars that cause cavities. But not just cavities is the big, just an issue, but gum disease, it's a different type of bacteria that causes that gum disease, and you can lose teeth just as quickly with having gum disease as you can with cavities. That's one of the bigger things that people neglect until it can be too late. You don't notice you have an issue because you haven't, gone to your regular checkups, and then we have to have discussions on losing teeth when it doesn't even have a cavity sometimes, and that can be a hard discussion to have with people. So yes, absolutely, just having a balanced diet. Otherwise, you wouldn't even know.
This question is also for Dr. Patton. How important is dental flossing as it relates to oral and internal health?
That's a great question.
That's a great question.
Flossing is very important because I'm a dentist. But I'll say this, when we can talk about string flossing or picks or water flossing, I think it's most important to do something. A lot of people don't do anything, so when somebody asks me, what's best to do, I say, use what you have, and then it's more a matter of how you use it. Your technique as far as, doing the C motion and getting along the tooth and getting under the gums with the floss, it's more about how you use it and the finessing and actual flossing than what you use to floss. I think flossing is important though, because you can't get everything with just a toothbrush. You have to do more than just brush your teeth. And if you don't do it every day, like most people do, don't do it every day. Try to do it twice a week, 3 times a week, and that practice will make a big difference. But yeah.
Okay. Now, this topic, I think, can be addressed by all 3 subject matter experts. This issue about distrust, mistrust, and no trust. So I want to know, in your profession, what kinds of things, if you could give us a couple areas that would cause a female, her husband, her family, to be distrustful of your particular industry. And then over here, Dr. Dennis, what kinds of issues in the field of dentistry would cause someone to mistrust the dentist? And then in your situation, risk management, what kinds of things would cause a person to distrust, mistrust, and no trust in regards to the hospital? So I'm going to let you start first.
In hospital setting, I want us to think about the people who go to the hospital. There's a different demographic of people that go to the hospital. Most of the time, people who are paying for their health care are not the people that are running to the hospital or to the emergency room. It's usually when you have someone that don't have access, have not been able to address their concerns regarding their health or what has been a problem for them physically and medically, is when they end up at the hospital. By that time, what the needs are far exceeds what an emergency room visit can do. They need something a little bit more extensive. That costs more money. That requires more testing. So the distrust comes in when a person shows up and they're told, well, you need this test, you need that test, and then we're gonna take this blood work, and then well, y'all are just trying to get my money. So that's financially is where a lot of the distrust comes in an acute care setting.
Okay, let's go right over here to the physician expert.
I think specifically for pregnancy, I think oftentimes it comes up with things that women complain about during pregnancy is passed off as, oh, well, that's just pregnancy related, or oh, it's just pregnancy. And I think that can contribute to it. I think the other thing that can contribute to the mistreatment or the mistrust between patient and healthcare workers or their provider is not understanding exactly what is being done or why it's being done. And so I think a lot of times there's lack of explanation of what's going on during the delivery or why we're doing certain tests or lab works during your pregnancy at different intervals. I think that has contributed to it quite a bit. And then the other biggest thing, I know the video touched on it too, but the perception of pain oftentimes plays one of the biggest roles that I see in a patient expressing, this is how I feel and this is the pain that I'm experiencing. And that pain either being downplayed
Yes.
or not being treated appropriately or not being addressed appropriately. Oftentimes that's what makes patients say, well, I'm not gonna go back next time I'm hurting, or I'm not gonna seek out care in my next pregnancy. And it creates that kind of cycle. And so when things are more serious, patients either aren't showing up or aren't trusting of what a medical professional is saying as far as what you need for treatment.
I'm going to go to Dr. Patton here, and then we're going to come back. You get a comment in regards to the issue about pain and pain medicine. And we're going to get a question out there.
I think it's really easy to mistrust your dentist because you can't see.
What's going on?
So we're talking about pain and fear, and that's what most people say all the time is they have a hard time coming to the dentist because they're scared of the pain that they might feel, or they've had poor experiences in the past as it relates to toothache or even the treatment that they've received. So a lot of what I do is about patient education and literally breaking down what's going on in the mouth in the best way possible through intraoral pictures and taking time with anesthetic and trying to get them comfortable so we can get past that barrier and then get at what the issue is, which is the infection, the source of the infection. Another reason outside of dental anxiety that patients tend to have issues with trusting the dentist is they can't see, what's going on, or they are dealing with it on a every single day basis. And so what I might point out as being something very important might not feel that important in the moment because it might be a chronic concern, a chronic infection. And so relaying that message across and using the language to really drive home the importance of what's going on can be kind of challenging at times.
Mm-hmm. I think that is very pointed because at the doctor, when there's something going on, you haven't, maybe you can't see what's going on because they either put you under or whatever. You have to worry about that. But when the dentist is doing their thing, they give you a shot with a needle in the gum, and you're up there working, and people are laying there curious about what is happening. So I can imagine that causing people to have a scared feeling. You wanted to make one comment about the pain. One comment.
So she was talking about pain, how pain is often not taken seriously by providers. And I just want to encourage you to rethink or reframe that thought. There are laws and guidelines that we have to operate under to address, when it comes to addressing pain. There's so many rules and regulations that we cannot just ignore, which is why we incorporate and share with you the different levels of care, because different levels of care, and Cynthia and I've talked in the past years and years ago, say if somebody's hurting so much with pain, then there may be a referral for hospice care. And that's because hospice care would allow certain use of specific types of medications that a regular doctor's office or that a hospital cannot actually
Administer.
provide.
Mm-hmm. Okay. Thank you. Have we been taking, let's right here in the middle. She talked about stopping in the middle. Let's give them a round of applause. Give them some more encouragement so their brains can be running. I know we have a question there. You want to stand up and give us your question? Yes.
I'm extremely proud of our panelists and definitely for including the dentists on the panel because we're often left out. And dental health is a very, very important part of our overall health. And I was very pleased to hear her talk about the oral systemic connection because there is a direct correlation between oral health and the rest of the body. And as it relates to women who are pregnant, we do know, as she stated earlier, that this can lead to early, what we call premature birth of children, a low birth weight in children, and just a whole plethora of things that can go wrong from bad dental health. And one of the things that I wanted to say before I sat down is that we in the medical profession need to start working together. When dentists can have an open relationship with the pedodontists, pediatric doctors, with the oral surgeons, with the medical doctors, and we can begin to educate our patients when they first come in about the importance of oral health, then a lot of the problems that we see with, I think, diabetes, cardiovascular problems, and all the other systemic connections or systemic diseases can be eradicated if we just start early. Yes. So thank you so much for having our doctor here today. Thank
Yes.
you.
Good. I'm going to go back and be like they do in the church. I see we have a pastor right here. You know, they always ask, do we have any pastors in the house? Would you please stand? Well, I'm going to say this. Do we have any healthcare people in the audience? I want you to either raise your hand, stand, tell us who you are. Other, right here, stand, sir. What we got? Can't hear you, but let's get a mic. We won't know who everybody is. Right here. Let's get it, find out. I'm like you, pastor. You got any pastors in the house? That's what you all do at church. You said, would you please join me at the pulpit? Right here.
I'm a registered nurse, presently working at an insurance company as an inpatient case manager, and Dr. Patman is my daughter.
Okay, well, call it out. Here.
Excuse me, Bill Oldman, recently retired from Hamilton County Health Department after 37 years. But I too can appreciate those who are members of the panelists. I think that this kind of presentation should be
Happen more often.
Oh, exactly.
In our churches, at our meetings. Yes, thank you. Any more over here? Right here, we got one right here. And then we got one right there. See what we're doing? This is what you call the power of knowledge. We don't have directories. I know we don't have one in Knoxville where if someone was looking for a minority or person of color in the various fields, you can't find them hardly. But we're working on it. We're working on the directory right here.
My name is Bertha Hayes. I'm a retired nurse practitioner.
Thank you, nurse practitioner. We got the thank you. Let's give her a round of applause. Did I see another hand over on this side? Right? You want to? Thank you, committee. Thank you, committee. Yes, right back here. This is good stuff.
I'm Dr. Angela Smith-Slack. I'm a pediatrician in Chattanooga. I've been practicing for over 25 years here. So it was very encouraging, as everyone has already stated, to see that panel. And when you made the announcement at meeting, I told my husband, I said, I'll put that on my calendar because this is a very important discussion for each of us to have. And I just love seeing y'all up there. I'm so excited.
Yes, absolutely. Do we have anybody else on this side? This is power here. Do we have somebody else? Pastor, why don't you just go on and introduce yourself? Pastor McKee. Let's go on so that introduce.
I'm Dr. Adam McKee. I earned a doctorate from Purdue University in theology. I'm a former district superintendent with the United Methodist Church. And I have found through my ministry that health is really important. And sometimes the spiritual elements, they get us trouble.
Thank you. Absolutely. So we got spiritual health, we have financial health, we have physical health.
I'm
Do we have-
Jennifer Woods.
Yes.
And I am an associate minister at Missionary Baptist Church.
Amen. Then we had a hand right back there. One more hand. Another pastor. How many pastors in the house? Let's hear from the pastors. Because spiritual health, isn't it, Doc? Spiritual health is very, very important to our well-being. We have faith-based care. It's good. Thank you so very much, husband.
I was also impacted personally by the issue of dental health. I ended up having to have open heart surgery at 39 years old and have an artificial valve in my heart as a result of, what is it? Of a bad tooth.
Of a bad tooth. Okay. See, this is very, very important. As we talk about, let me just right now give a round of applause for this wonderful committee that has pulled this together and how important it is for us, not as just people, but as Black people, to make sure that we're discussing this issue of health. It is very, very important. Now, one thing, I know we got another question, but you all get prepared because the question I want you to answer is what happened during COVID when everything was shut down? So let's be thinking about it. Let's see what this question is back here in the back.
Okay, these questions are related to dental health.
Okay, Ms. Denham. Ms. Dennis over here.
If it's permissible, Madam Moderator, I can just read all three of them. And
Then she'll let her answer the question. Okay.
Questions are, what kinds of diseases can be discovered by a dentist in a patient's mouth? Could you please speak on the importance of gum, denture cleaning, and what could happen if dentures are not regularly cleaned or the gums under the dentures are not regularly cleaned?
Okay.
And the next one is how can dental patients recognize the signs of post issues after dental surgery?
Subject matter expert, get with it.
Right, the only question I remember that you asked.
Start with the first one, Jennifer.
Let's talk about these dentures.
Okay, yeah, that's what I was about to say. So for dentures, you're supposed to take them out every night. A lot of people tend to leave them in at night or only take them out never. But you're supposed to take them out every night because you have to let your tissues breathe. And also doing that also helps to cleanse the mouth, just like all the rest of your body. Leaving the device in the mouth like that can breed bacteria or fungal infection. And so if you don't take them out, you might develop candidiasis in the mouth and have to take different medications for that. It can be painful if you leave the denture in too long. And so it's just important to keep it out on a regular basis, not only to let your tissues breathe, but also so that you can clean the denture properly.
The next question, I think you mentioned some of the diseases. They asked what kinds of diseases in the mouth.
So different types of cancers, lung cancer, prostate, breast. Those are cancers that you can catch metastases in the mouth. As far as bone health, bone density when looking at x-rays. Pregnancy, granulomas can be different nodules detected in the mouth. If someone doesn't know they're pregnant, you might find out at your dental visit.
Is that right? That's right.
That ain't good.
Mm-hmm.
And disease or different things like that. There's a whole bunch of different systemic diseases that can be caught in the mouth. Some that I might not have mentioned earlier, you might show signs of having diabetes, coronary artery disease, rheumatoid arthritis. There's things that not just as simple as looking in the mouth and saying, oh, you have that as something going on, but there can be signs or manifestations of that are present in the mouth.
What about canker sores? Canker sores.
Absolutely, canker sores, herpes simplex, those sorts of things as well.
Don't change the mic because we got some.
What's a granuloma?
A granuloma is something like a blister. It's like a little bit nodule, or maybe if you've ever had a sty or ulcer on the mouth, it's a liquid filled sort of papule in the mouth. It's kind of viral. No, kind of. I don't know. I'd have to show you a picture.
Okay.
It's not pus filled.
Just like a raised something.
Vesicle sort of. Anybody help me out with the words on that?
She's doing a good job. She's doing a good job.
It's not hard. It's soft. It's liquid filled, but it's not a vesicle. It's a granuloma.
Well, let me say this. I wouldn't, if I had to put together a panel, I don't think I would have thought immediately about having a dentist. So I'm going back to Knoxville, Tennessee. I'm going to have, let me have that mic. I'm going back to Knoxville, Tennessee. I'm going to put together a panel discussion like this, and I'm going to find me a dentist. We don't have a lot of black dentists in Knoxville, but we'll find, even if we have to have you to come all the way to Knoxville. Is that right? Is that right? Okay, we got some more questions here, but the question that I put on the table is what happened to pregnancy care during the COVID? What happened to dental care during the COVID? And then what happened in the health system, particularly, I'm gonna give you about 3 or 4 seconds or so to respond to that, because that's a big question. So we're gonna go right here to Dr. Adams. And you get your questions ready out there in audience.
Initially during COVID, and at the time of COVID, I was actually in my residency at Erlanger, so I was in the hospital at what felt like 24/7. And so initially what we saw
626, we're doing good.
is we saw an increase, of course, with admissions of pregnant women with the virus versus people being, staying at home and, doing, just kind of over-the-counter care and that type of thing. But the respiratory system of a pregnant woman really took a hit with the virus. The other thing that we saw, because everything was shut down and people were encouraged to be home and wear masks and that type of thing, which is great. But we saw, we did see a decrease in women accessing prenatal care. And I'd say that more anecdotally, but we probably had more women, even just through our clinic, that waited to come in to establish pregnancy and to establish care because of COVID. And then there was this theory or, the thought process, well, the risk of me getting it might be higher if I go to every single appointment. And if I've been pregnant before, I kind of know what to look for and kind of what's going on. So we had a little more interrupted care throughout that time. But the significance, it's very rare in pregnancy to see women on a ventilator. And that was something that we had multiple patients in the ICU on the ventilator, and we're monitoring their baby at the same time as monitoring mom, and really hoping that we get them to the point where they're not dependent on this level of oxygen so we can get them to the other side of delivery. And it took a lot of coordination of care, but I think overall, at least at Erlanger, which is where I was, the teams coming together did a really, really phenomenal job. Not only in getting ORs that can accommodate patients with COVID for different surgeries, but the ICU teams, the inpatient teams, the hospitalists, the OB teams, everybody did a really, really great job coordinating all of that.
That's a wonderful answer. Ms. Dennis, here you go. Okay.
I think a big thing that affected dentistry during COVID was that access was a big factor, because not only was everything shut down, but dentistry is something that seems to get neglected more so than overall health when it comes to medical treatment. And so a lot of patients, plenty of patients still have not got back in the swing of things of seeing a dentist on a regular basis since COVID. And so with that, there are a lot of chronic infections that were neglected, and the manifestations of that now, and just having to restore with what's been not treated for a couple of years.
Okay.
Kind of trying to keep up with what been kind of been put off.
Right. We're in recovery. This COVID,
Still,
we're in
yeah.
recovery still. So let's have a response from you, and then we're going to get some more of those questions. How are we doing on time? I know we got about 30 minutes, and we're going to get. Want to comment on that? Or you want to wait till she responds? You can respond to the overall topic. Go on, you.
What I saw what we saw in the hospital or the acute care setting, there were, unlike you, there was an increase of people showing up at the hospital, to the point where patients would show up and our response would be, we don't have any beds. We were treating people, I almost get teary-eyed thinking about it, because that was a pretty intense time.
Yeah, it was bad. It was hard. Okay.
We had patients in the hallways.
It was bad.
We were tagging people's toes based on their acuity level, meaning how sick they were. Then it got to the point where it wasn't so much because we didn't have any beds. We were getting sick too. We were getting sick and we were dying. Our providers were dying. Our nurses were dying. So if we brought you into our hospital, we didn't have anybody to take care of you. So we would have to, at some point, stabilize you the best way we could, but not even keep you. We had a shortage of equipment. I worked down in Dalton, so the carpet mills down there, they stopped making carpet and started making masks. And were sending them to us in 18-wheelers. Medications, people started to explore medications. because we didn't know what we were dealing with.
Right.
So we couldn't guarantee that what we were providing was gonna be effective. So people started experimenting with medications like home remedies. People started experimenting with the medications that they use for animals. It was pretty bad. And then nurses got burnt out because those that were sick and those that were dying, they left gaps in the working schedule. So by the time you got home off of your 7 o'clock shift, before you got home, I was on the phone calling you, asking you, can you come back at 9?
Mhm.
And can you work till in the morning? And then, last but not least, I mean, people thought that at some point the hospitals were getting paid money. They thought that we would bring you in to our facilities and give you COVID so that we could make money off of
It's
that.
all kinds
So it
of
goes back to that trust issue.
yes.
That you were talking
Misinformation. Is your issue, your response around this topic? We're talking about COVID right there. And then we're going to see what kind of questions we have out there.
Yes, as I stated earlier, I've been in dentistry practicing for over 32 years. And the dental industry suffered drastically during COVID because when you think about spread of infection and how infection spread, it is through open orifices and open areas. And the mouth and the nose is the primary source of spread of infection. So during that time, most of my colleagues, including myself, we were closed. Most of our hygienists were looking for different areas to work because nobody wanted to work in the dental office where they had to clean teeth.
And be exposed.
These things are airborne pathogens, which would spread the potential virus. And so there was a period of time where most of our offices were closed. And so it's still one of the situations that we deal with every day is the spread of infection from the mouth.
Yes,
so
yes.
I want to say that because we did suffer and a lot of us were down for months.
Yes. And as we get ready to go to another questions out here in the audience, I would like to say that the work that we have been doing in the Knoxville area, in the 16 county areas, has been a lot through an organization that I founded because we couldn't get the folks, the health department, the Department of Health to come over to the Black community and provide what we needed. Begging for tests, begging for, then when vaccines came out, well, what we did in Knoxville, we banded together and I went and got my friends in Atlanta, some epidemiologists in Atlanta, Georgia, to come all the way to Knoxville, Tennessee, to provide testing and to do vaccines. When that pissed off the Commissioner of Health about why we were bringing people from here, it's because I've been calling you, we've been calling you, and you didn't come. So they came, and then once we got their attention, then they started setting up clinics for us. And we ended up, the Black folks, with over 400 volunteers and nurses and doctors and so forth, we ended up vaccinating over 300,000 people. Not only just the people in Knox County, but in the little counties and rural surrounding counties where our Black folks couldn't get no help. So I want you to give me a round of applause because we did a really great job in there. And I'm sure you did here in the Hamilton County area too. We had to band together as community as it relates to this crisis that was going on. You got a few more questions?
This question also relates to COVID.
Okay.
What post-COVID signs or symptoms are we currently seeing women experience with pregnancy, especially in women who have received the vaccine?
So what we're seeing is kind of a sequelae of COVID is more specific to having had the virus and or having the virus multiple times, more than from the vaccine. The vaccine is recommended by ACOG. I recommend the vaccine and recommend the booster also. It doesn't, not necessarily specific to pregnancy, but just what people talk about now being long COVID. So seeing adverse effects and issues with the kidney system with liver, of course, with the respiratory
Do you have
system.
anything to say about this
One of the
topic? Or
biggest
just, you can go
things
on.
being
Do you have
this
anything to say about
issue
this?
of
You have
being more
something?
prone to clots or embolisms. And so, and that again, kind of, that's not just specifically to women, but women and men. And again, what mostly it's with being infected and having repeat infections because there is a lack of vaccination.
Yes. And when we talk about the lack of vaccination, I'm going to give you some education in regards to vaccines right now. How many have had their updated vaccine? Okay. How many do you know, or have you had difficulties finding, well, you know, on May the 20th of 2023, the government commercialized vaccines. What does that mean? It means that if you have insurance, you can go to these big box pharmacies, Walgreens, Walmart, CVS, and others, and maybe some moms and pops, and get your vaccines. But just think about our work that we have been doing in our area and then across the country, educating people and convincing them that the vaccine is one of the answers to stay safe and not get COVID. Even if you get COVID and you already had your vaccine, you're not going to get as sick. And then all of a sudden, they put a stop to vaccine access as it has been in the past. Well, across the country, and many do not know, they're advertising, get your updated vaccine, get your updated vaccines, get your updated vaccines if you have insurance. But if you do not have insurance, let me say that again. If you do not have insurance, your nieces and nephews and all the people that don't think insurance is that important, don't have insurance, you might not have access to the vaccines. Now, they do have a program that the federal government created called the Bridge Program, but providers have to sign up for it. Now, I'm thinking back when I was really working in TennCare, when you couldn't get providers to participate in TennCare. Well, they're not necessarily wanting to participate in the Bridge Program. So when your people who do not have insurance, they're running around trying to find a bridge provider. It is very difficult. Now, I want you to keep your eyes and ears open in regards to that. So when you say, okay, have you had a vaccine since September of 2023? That's when you can gauge whether you need the updated vaccine or not. September of 2023, if you haven't had a vaccine since then, that means that a person should be seeking to try to get their updated vaccine. But once again, access is a challenge. Last Friday, I got my approval to be a bridge provider, thank God. That means that when we get this vaccine in hand, which we're getting ready to order it in bulk now, we're gonna have clinics all over the East Tennessee. Again. I think it needs a round of applause. How are you all doing here in the Chattanooga, Mr. Health Department man? How are they doing in regards to access to vaccines here in Chattanooga, or do you know? You can get it at the health department. You can get it at the health department. You do. And some of the recreation centers provider is giving. Now, I know health departments are very limited in what they can do. The challenge we've had with public health is because they close at 4:00. And we need to have, our agency, our work, we had vaccines 24/7. We'd have them at 3, all the way to 3:00. We stop at 3, start at 4, go to 9. If we knew the third shift was gonna be on, we'd have a vaccine clinic then. So some of the things that we've been telling the system, those people in charge of this public health process, the public health is responsibility of the government. We've been telling them that here are some of the pitfalls that happened during COVID as it relates to. And that's what we, the voices.
Partnerships and collaboration.
Yes, voices together, telling them these are the areas where we had some gaps. Now we'll take 2 more questions.
2 more? Okay, so let me get to the serious questions, and I'm not saying everybody's question is not serious.
You have to have another one of these.
Very, very serious questions. But here's the questions that we really, really need to address. What are some of the ways to teach doctors how to relate to their patients on the DEI?
Right there.
This is my favorite. I am a firm believer that you can be in excellent position. You can know your stuff. You can know all the things about what your specialty is, but you might not be the best person when it comes to engaging with people. That is why they have a person like me. I spend my Wednesdays teaching physicians how to engage, what language to use, not standing over your patients when you're talking to them. Take a seat, how to read the room, how to mimic what it is that you see the patient and the family. What language do you need to pick up on? Do they need an interpreter card or a live interpreter to engage and communicate? How to use terms that they understand versus what you learned during your residency. So those are things that we talk about all the time.
Okay.
Question number 2. What are some of the things being done to address the discrimination in pregnancy deaths? I promise I didn't write that.
And what in pregnancy what?
What are some of the things being done to address the discrimination in pregnancy deaths?
Pregnancy deaths, the high number we have.
Yes, that number is very high. And so there are different things kind of at every level. Specifically in Tennessee, there are new state mandated programs that hospitals are having to opt into and report different data points and report things back. There are new programs now where if a patient is at risk for high blood pressure in pregnancy or has high blood pressure in pregnancy, they're provided with a free blood pressure cuff. And a reporting system that not only reports to an outside system, but then also recommended to report to their OB physician. Of course, hospitals are working to do trainings to discuss things like inclusion and to talk about how we relate to patients and to talk about how we need to listen to patients and to patient advocates. The doula program or system, the hospitals have now opened up the labor and delivery floors back for doulas, or for a pregnancy assist person, and that person is no longer being counted as a family member, they're being counted as a separate entity, so now patients are able to have their mom and or spouse or partner, but then also have the doula there with them also. I think from a provider standpoint, it's the responsibility of the provider, but I think hospital systems should be doing more to make providers aware of these numbers, and reporting those numbers out and seeing how we fall and what we're doing.
Here's another question. Define advocacy, and then what are the effective steps that we can take for advocacy and advocating for my personal health?
Yes, I think that is a great question, and I know everybody probably has a response for that in regards to advocacy. But I'm going to let expert right here answer this question, and then I'll have something as we get ready to close.
I want to back up a little bit if I can, talking about that racial disparity with moms or pregnant moms. I think it's stuff like this that's happening right now. It doesn't start when that mom is pregnant. It doesn't start in that doctor's office. It doesn't start at the hospital. We have to look at our social determinants. We have to look at our economic policies that are in place. We have to bring people to the polls to vote because there are political systems that are in place that are creating intentional barriers to healthcare. We have to talk about the social policies that are in place, and we have to talk about these healthcare entity development agendas. People get together all the time in rooms where the doors are closed, where you have not been invited to the table, and they are creating and developing programs and systems that do not always include people that look like us. I teach a class all the time around the city, in Georgia, Tennessee, Alabama, wherever, and we talk about who's at the table. And if the table looks just like you, then something is wrong with your table. Now, I have another thing. I used to think that if you didn't invite me to the table, that's fine. I would create my own. Nuh-uh, I want at your table.
Amen.
I want at your table. And so what we have to do, we have to put ourselves in positions. We have to become educated. We have to become willfully aware. We have to be engaged and involved. We have to vote so that when there is a seat at the table, they cannot tell us no.
Okay. Let's give everybody a round of applause. Let me say this to Pi Omega. You know what you got to do. Next steps. We've already heard from the audience that they want this. They want this. All these questions. That means that all these providers that we have in this city and in this one organization, that this is something. Let's give our chairman a round of applause right here. We know we got some more questions, and hopefully if they have an individual, we can have them just pass them up and down here. But I know that tonight we're almost at the end of this wonderful session. We want to respect your time, but I want to say thank you to Pi Omega. I came all the way from Knoxville because this is a work that I'm passionate about. I retired in 2017, and somebody said to me, well, how can you be retired and you're doing all this work? Well, I said, I started saying, well, I'm refocused. So that's my response when people say that you are still out there pushing the agendas. This was a mighty statement here, because that's where, we don't have expanded Medicaid, and we don't have all these things that we need, and we're trying to get all these issues about, can't read this book, we have to get involved and vote our own conviction, but keep in mind that we have our grandchildren, our great-great-grands, and all the ones that are coming behind us, that we got to make sure that everything's in order. So thank you for this opportunity, and we're going to get a closeout. We have all these pastors in the room. I know somebody will come up here and pray. Thank you so very much.
The next step, I'm glad you asked that question. Pi Omega chapter of Alpha Sorority Incorporated in Chattanooga, Tennessee, Advocacy for Social Justice Committee. We are actively engaged in social justice issues, just in Chattanooga, not just maternal health. We are actively engaged in changing the environment that we live in by getting out the vote. We're encouraging everyone to become an advocate in your space. Now, what does that mean? Each one of you impacts 10 to 20 individuals. Ask them 3 questions. Are you registered to vote? Do you know where your voting precinct is? And when is the last time you have checked to make sure you have not been purged from the voting rolls? I'm supposed to be bipartisan, and this is a struggle. But if you're being aware of what's going on Capitol Hill in the state of Tennessee, you know that there are many issues that are impacting the lives of the average citizen here in the state of Tennessee. And unfortunately, we're not being heard. So please, please, please feel free to pick up the telephone, to call your local elected official. It does not matter if they are a state official. It does not matter if they are a county commissioner, a city councilman, a school board member. It does not matter who they are. They were elected to represent us, and we must hold them accountable. Our lives are dependent.
Acknowledge the fact that we have the voters registration back there in the back.
Yes, if you have not checked your voters registration, if you are not registered in the state of Tennessee, or if you have moved to Chattanooga from another area in the state of Tennessee, the Tennessee Democracy Network is a nonpartisan, nonprofit entity back, wave your hands. They will register you. They will help you to make sure that your registration is up to date and everything you need is accurate. Back to this corner, raise your hand. We have the Hamilton County Health Department. Any healthcare needs or questions that you have that have not been addressed here, you can go back there. They have tons of information that they are willing to share. Pick up the stuff that is on the table. We'll be glad to help you. They'll be glad to help you and assist you in any way. With that being said, my last comment.
Good evening, everyone. I also want to say thank you, panel, for sharing very important information with the community. While you all are here,
Let's give them a round.
While you all are here, I want to ask if you all are willing to participate in a community survey for Hamilton County, those residents. This survey that we have is a private, nonpartisan survey, 5 to 6 questions, and we just want some feedback for the local elections that's coming up. Thank you.
Well, let's give our panelists another round of applause, please, for the outstanding job that they did. And I want to thank each of you individually and collectively, because you all, when I called, you all immediately said, oh yes, oh yes. And I'm not gonna call out the people that said no, oh no, but we have, these ladies, they stepped up, they came out, and I'm gonna say it's like they said when I was growing up, and they have definitely shown out. At that time, I would like to present each one of them with a token of appreciation for giving their time, their effort, and coming out to support this initiative. And I'm gonna take a moment of personal privilege. When I called Cynthia Finch on a Saturday morning, and told her what I wanted to do and what the committee had charged us to do, she and I said, I need a moderator. She said, oh, I would be more than happy to come and do that. I asked her how much did she want. She said she would not accept pay. I said, well, at least let me buy your gas. She said, no, this is near and dear to my heart. She came all the way from Knoxville, Tennessee to Guam. So that shows the level of dedication that this lady has. With that being said, I gotta give a hug.
I'll take a hug. Thank you. Come back.
Before we close, I would like to, for all of my committee members of the Advocacy for Social Justice Committee, this would not have been as successful without you all. Would you please stand so that the people here can recognize you? With that being said, all hearts and minds are ready. I'm gonna ask Reverend McKee, Reverend Slack pointed to do the benediction.
This is my buddy. Hey, let's stand. Cynthia, it's good to see you again. We worked together at MPHC in Knoxville.
Yes, long time.
Lord, we call upon you, for you are the great physician.
Yes.
You are the one who can raise us up when life knocks us down. You're the one who has the right touch when you touch our hearts, when you touch our minds. And you're the one who gives us inspiration, for you are the original author of affirmative action.
Amen.
We are to engage in the community. We are to hold high the bloodstained banner of Jesus. And we are the march in the light, seeking to help anyone who's down and needs our help. It's in the name of Jesus we pray. Amen.
Please feel free to hit the refreshments. I don't
I want to see if we can get us a picture together.
Okay, yeah, that'd be
Three
great.
panelists.
Check with the temple card and the other
Pleasure being on the panel with you. Nice
Wait, before you start,
Okay, wonderful.
I'd like
Come on, I want to get a picture with us.
Karen,
sincerely recognize
Karen, come and take a
Rocky
picture.
Rhodes. Would you raise your hand?
let's do it.
He's here early. He's live streaming this for Alpha Kappa Alpha Sorority Incorporated. It's on Facebook. It will be on YouTube for WPTP 101.1 FE.